Top 10 Silent Heart Attack Warning Signs You Shouldn't Ignore. When you think of a heart attack, you probably imagine someone clutching their chest and falling dramatically to the ground. However, there is another type of heart attack that works insidiously, quietly, and without the drama of typical chest compressions. Silent heart attacks, as the name suggests, occur without noticeable symptoms. This insidious nature makes them difficult to detect, as people are often unaware of their condition until further testing reveals the truth. Shockingly, of the approximately 805,000 heart attacks that occur each year in the United States, approximately 170,000 are silent. These staggering statistics highlight the hidden danger of these events. Without immediate medical attention, silent heart attacks can cause serious heart damage and even death. Despite the lack of immediate symptoms, there are important signs that can tell if you are at risk of a silent heart attack. In today's video, we will cover 10 important warning signs that you should not ignore. Understanding these subtle indicators can save lives by encouraging early intervention and treatment. Let's explore these warning signs in detail to get the information you need about your heart health. Jaw, neck, or upper back pain. #on. Jaw, neck, or upper back pain. When recognizing the signs of a heart attack, most people consider chest pain as the main indicator. Although chest pain is one of the most important warning signs, it is not the only one. In fact, many people who have had a heart attack report having neck or jaw pain before other symptoms such as shortness of breath and nausea appear. This is because the heart muscle contracts strongly after a heart attack. This can stress the bones and ligaments, causing pain in the jaw or neck. Excessive fatigue. #2. Excessive fatigue. Excessive fatigue is when you feel tired all the time and is one of the early warning signs of a heart attack. Study by the American Heart Association looked at 515 women who had a heart attack and found that 70% of them experienced unusual fatigue before the heart attack. This is because during a heart attack, your heart is working hard to try to pump blood when blood flow is blocked, which makes you tired. While fatigue may be due to workload or changes in sleep patterns, feeling tired for no apparent reason could be a sign of a silent heart attack. Chest pressure. #3. Tight pressure in the chest. If you feel pressure in your chest, this is a sign that something is wrong with your heart. This pain is also called angina or substernal chest pain. The pressure usually feels like an uncomfortable pressure in the middle of the chest. It can feel more like an attack than anything else and last for several minutes at a time. If you ever experience this type of chest discomfort, it is very important to take action as soon as possible to reduce the risk of permanent heart damage. Some other non-cardiac chest pains can be caused by esophageal, lung, stress, anxiety, or musculoskeletal injury. Sweating. #4. Sweating. Sweating in the heat or during exercise is a natural process and some sweating is expected. However, if you find yourself sweating even when you're not active or it's cold outside, it could be a sign of something more serious, like a heart attack. When your arteries are blocked, your heart has to work harder to pump blood, so your body sweats more to keep your body temperature down during this extra work. So, if you are sweating more than usual and are accompanied by other warning signs such as nausea, lightheadedness, and dizziness, get checked out right away. Edema. #5. Bloating, nausea, or poor appetite. Feeling full even when you haven't eaten much, and nausea can be signs of heart failure. This is due to fluid retention. In addition, the heart does not pump efficiently. The volume of circulating blood decreases and is transferred from the digestive system to more important organs, such as the brain. This gradually leads to weight and muscle loss. So, if you experience sudden changes in your appetite for no apparent reason, it's a good idea to get yourself checked out. We're halfway through our list, and we sincerely hope you've enjoyed it so far. Don't forget to subscribe my channel. Hit the like button and ring the notification bell for more content like this. Let's continue with the video. Dizziness or vertigo. #6. Dizziness or vertigo. When you have a heart attack, your body is deprived of oxygen because blood flow to part of your heart is blocked. Your heart can't pump enough blood. Bodily functions begin to fail, causing dizziness. However, some people experience dizziness as a symptom without other indicators. Such cases are usually caused by stress or dehydration. However, if the feeling persists, you should consult a doctor and make sure that it is not caused by something more serious. Difficulty breathing. #7. Breathing difficulties. Apart from the heartbeat, most people do not notice the involuntary inhalation and exhalation of the lungs, but it becomes very noticeable when it stops working properly. Shortness of breath is the feeling of not being able to breathe effectively. The lungs may feel heavy, or the patient may be forced to breathe rapidly and shallowly. It can be caused by anxiety, anemia, or allergic reactions, but is usually caused by lung or heart problems and is more common in women. Regardless of the cause, shortness of breath is never a symptom to take lightly. Swollen feet, ankles, or abdomen. #8. Swollen feet, ankles, or stomach. Edema is caused by a buildup of fluid in the body. During a heart attack, the heart loses its ability to pump blood efficiently. As a result, blood can back up into the lower legs, ankles, and feet, causing swelling. The circulation of the kidneys is also disturbed. Therefore, they are not able to remove sodium and water from the body. Fluid retention is a sign of a heart attack in about 20% of cases. If you see these signs in yourself or someone else, it's important to act quickly. The sooner you see a doctor, the greater the chance of avoiding further complications of a heart attack. Constant cold. #9. Constant cold. If you develop a cold and can't shake it, it could be a red flag. Studies have shown that the flu is associated with an increased risk of heart attack and stroke. 2018 study found that the risk of a heart attack increases 6-fold within a week of getting the flu. While the flu itself won't cause a heart attack or other permanent damage, it can be a sign that there are problems in your body that can predispose you to heart disease and other heart problems. Especially if it starts after a normal increase in heart rate, you are short of breath, or you notice other symptoms of heart disease, such as chest pain or pressure. Sleep disturbances. #10. Difficulty sleeping. Yes, lack of sleep can indicate serious problems. A study published in the journal Current Cardiology Reviews shows that people who experience restless sleep have a greater risk of heart disease. When a heart attack occurs, the left coronary artery is blocked by a buildup of fat or a blood clot. This prevents proper blood flow to certain parts of the heart. As a result, certain areas of the left ventricle do not receive enough oxygenated blood and begin to malfunction. The body responds by releasing stress hormones such as adrenaline, noradrenaline, and cortisol. These hormones trigger other reactions in the body, including sleep disturbances. So if you can't sleep well and spend the whole night tossing and turning in bed, it could be a serious problem. When it comes to your heart, paying attention to small details can make a big difference. Heart attack remains one of the leading causes of death worldwide, underscoring the critical importance of proactive heart health care. Simple lifestyle changes such as a balanced diet, regular physical activity, effective stress management, and quitting smoking can significantly reduce the risk of heart disease and heart attack. You notice signs or symptoms that concern you, whether or not they are similar to those discussed in this video. It is very important to seek medical attention immediately. Do not ignore potential warning signs, as early detection and intervention can save lives and prevent serious complications. If you think you or someone else is having a heart attack, don't hesitate. Call 911 at 911 right away. Acting quickly can be critical to ensuring timely medical care and improving outcomes. We hope you found this video informative and valuable in understanding the signs of a silent heart attack. If you have any feedback or questions, please share them in the comments section below. Don't forget to subscribe to our channel to stay updated on health and wellness content. Be sure to like and share this video to help spread awareness about silent heart attacks and how to recognize their warning signs. Thanks for watching, and remember, your health is your greatest asset. Stay healthy, stay informed.